So, hello and welcome, Dr. Roland. India became the first country in South Asia to introduce Liebscher Pain Therapy, right? It's a technique for natural pain relief. And
Yeah,
about 20 medical professionals, I believe, have received training certificates at the Art of Living International Center yesterday. So,
yeah.
let's begin by, can you just tell us a bit more about it and how exciting all of this is for you?
Very exciting because until now I only taught medicines and physiotherapists and osteopathic people in Germany, Austria, and Switzerland. A lot of them, more than 13,000, the last 17 years, but never outside because of the language and how to start in another country. And then last year in January, I visited the ashram here, and I fall directly in love, and I felt very home and a good feeling. And
Right.
then so the idea was created to bring the therapy here because Petra, which is my wife, she's a doctor, Petra Bracht, she's a doctor, and my vision is, at last, to inform every people on this planet that there are easy and very effective possibilities to help themselves with pain, and also for the therapists and doctors to help in such cases in which the pain is very complicated, but because also this exists from time to time, so that the pain which is suffering many millions of people, a big part of this can be solved in a very natural and very easy way without using painkillers, without using surgery and things like that. And we want that this information is getting to every people on this planet at last. Yeah, at least. Yeah.
That is wonderful to know. So, before we get started with the questions, please give our viewers a brief introduction to Liebscher Bracht Therapy, what it is about, how you guys do it.
Okay, it's very easy. The fundamental thing for the therapists is the last 37 years, we created a known system of 72 points on the human body, special points we found out. And they are not in the muscles and not in the tendons, they are directly on the bone, so-called periost. And these receptors there, they are able to bring, when you press on it, to bring the information to the brain, that the brain starts changing the programs of the muscle tense. And we know that most of the pain people are suffering comes from too high tensed muscles and fascias. And you can imagine like a computer. If the computer, the wrong program is on, you or some mistake does not work correctly, then you end it and start again, and often the machine runs. And a little bit like this, we are dealing with the body. And what helped me a lot was I'm engineer, and I could see the pain and the muscles and all these situations with totally other eyes than doctors and physiotherapists look in it. For me, forces and pressure and things like that and mechanism is in my head, in my world. And that helped me a lot to understand the biology of the a human being in another way, on another level than the others are doing. It's not one is wrong and one is right, not like this, only another understanding of it, and that helped a lot. And then we found out if we reduce and normalize this muscle and fascia tense, then the pain is away. Not because we are killing it or we are working against it, but because the body now has the feeling, because of the other programs for the muscles, that everything is okay. And the tense is not too high, the joints are not being to go damaged. Yeah, everything is okay. And then the body itself, the inner doctor, my wife always says, the body itself decides to put the pain away. And that's, for me, that's the one and only and natural way to deal pain like this. Not all. We are not speaking from very terrible accidents or things like that. Yeah, we are speaking from this pain which is in all day. Yeah, head pain, neck, shoulder, the back, lower back, the hip, the knee, all this, and the elbow and wrists. Yeah, all these pains for us in the most cases is because of this too high tension of the muscles and fascias.
Right. That is very interesting, Roland. So I believe you have more than 3 decades of experience in this field, right? So you
Yeah.
must have come across various types of pains. So what are the most common types of pain that you have encountered in your practice?
Yeah, like I said, all this pain in the movement system, like the joints and the back, the vertebra, all what is connected with this. And you know, most people they suffer exactly on this pain, pain from the inner organs or from some surgery or from heart illness like cancer. It's not the thing. Yeah, it's all of the muscle and fascia system, the movement. Let's say like this, many people, they think it's normal when they are 50, 55, 60, that more pain, less movement, and the elder, the more. And all this pain, which is created official from the age, we know it's not from the age, it's from to move not enough, to move one-sided and not to balance it out. For example, sitting around. Not the sitting is a problem. The problem is that we don't balance it out and make some exercises to bring the body in the balance again. And that's so easy. If you know why, if you know how, then it's very easy. But this knowledge to know the exercises that people can do to help themselves, this knowledge also in Europe, you don't learn in school, you don't learn in university, because what we found out with the muscle tension, I don't know why. I don't know why, because since 35 years, we wrote 22 books, we did endless conferences, but our way to deal pain, there must be some reason, because many people, they don't trust in it. And because of this, 2015 at least, we said, now we are going to give all these exercises free of charge in the internet so that the people can try. And in the moment they try, also for you here in India, we have the English channel, not the Indian yet, but it will come. But the English channel, many people speak English, they can give their pain in, they find some exercises, they try it out. And in many cases, it helps. Even when there is arthrosis in the joint, or they have broken discs or things like that. In many cases, it helps. And then for the people, it's clear. They do it, they feel it's better. And so for them, it's clear, okay, I have to go on. And our aim is that all these exercises and how to deal the pain with exercises, everyone knows. And the therapeutics, they have a special function, because many people, they are afraid, oh, my joint, there is arthrosis. If I do an exercise, maybe it's becoming worse. And then they come, and then we treat the 7 points. And in most cases, it's going down to 0 or 30% in the first treatment. That's very interesting, because we are only changing the program. The body is not necessary to build in another structure. Like the computer, yeah, we have not to change some parts from the hardware, we only go in the software. And we go into software from the human brain and make the tense normal. And then the body itself decides. And often he decides, or it decides, yeah, now the pain is not longer necessary. to warn the patient not to do this or that, so that the situation is not going worse and worse, and then it's done.
You rightly mentioned that, there's a popular misconception that age and pain are quite related, but as you said, it's a misconception, right? So let's get
Yes.
some basic understanding of pain itself. So where does pain come from, and what are the key practices or the key principles or techniques used in Liebscher and Bracht therapy method for pain relief?
Okay, also for us, it's our research and our experience. For us, it's again very easy. We are sitting around. Let's take that as an example. Then the hip is 90 degrees and the muscles in the front are shorter than standing. So when we sit 10, 12 hours, because not only in the office, also in the cinema, in the bus, in the car, in the airplane, yeah, we always are sitting. And now in the front, the muscles and fascias, they learn because the body even changes its structure like the training is. And so this sitting is like a training. And then when it's shorter in front, we want to stand up again. And then the body remarks, oh, I'm moving forward. And what's very interesting, elder people, 70, 80, they use this, the German word is Rollator. Is it understandable? Rollator is this little thing they walk along and they lean on it, yeah? And if you watch
They use
these
for
people,
support.
yeah, if you watch these people, they always are like that, lean forward. It's exactly the result of a life of training to shorten all this, the sitting around and not making some exercises to bring it in balance again. And so what is the most important thing maybe for your people who look at it and listen? Very easy. If you have back pain in the lower back, then stand up, put your both hands against your glutes and lean back. So easy the contrary of this, what we are doing sitting. And the people will notice, will feel directly this back pain is going to be less and better and maybe gone after some days. But then the big mistake would be not to go on with the exercises. Yeah, because
Exactly.
you must understand, please. It's like this. Every human being has a profile of movement. Very special. Now, the profile of movement sitting around without balancing out makes some gap. Yeah, there something is not done, which would have been to do, I think. Mine is not so super, sorry. Yeah.
Yeah.
So, and then for this lifestyle, for this movement, 2 or 3 exercises, or maybe this one exercise is necessary. Now you do it. Or they go to a therapist and he releases the muscles like this, and then the pain is going down to 0 to 30%. That's our experience. It doesn't function, or it goes down like a little rest only this there. So, and then the body minimizes the pain or put it totally away because all the informations from these receptors to the brain calculated, and the new result is no danger anymore, and he stopped the pain. And in the moment we do this exercise every day, it's only 2 or 4 minutes, yeah, it's nearly nothing. Then it's like this for the rest of their life. My opinion, okay, yeah. But when they stop it after 2 weeks, oh, I'm healthy again, yeah, it's the wrong thinking, because then the all-day movement would create another pain like this before. And that's the understanding. Every people has to do their movements to balance the lifestyle out. And when they do it, no problem. When they don't do it, worse, worse and worse. And at the end, they sit around. At the very end, they only lie because the movement is not longer possible. It's terrible. And we have to inform the people that's not necessary to live like that.
In a way, we are actually on a path towards self-healing through these exercises and these pain therapy, right? So I believe you do get some level of skepticism as well, because people are so used to taking medications when there's pain.
Yeah,
So how do you
yeah.
educate your patients about self-healing techniques for pain management?
Very, very easy. Very, very easy. In the moment, I can motivate them to do the exercises. It's going from alone because they feel it's better. And that's the key, yeah, because then they go on with it. And also for our therapeutes, that's because many, for example, in Europe, and I think here in India is like this, many physiotherapeutes, they give exercises to their patients, but they don't do it. Why don't they do it? Because they must have the hope that in some days or some weeks will happen that the pain is reducing. But that's too indirect. And our big advantage with this therapy is because we are dealing with the software of the brain, we can change it in the first treatment. Yeah, and then it's very easy. A patient comes and maybe he is not believing in it, but the pain is so hard, and he tries. Yeah, and then he is lying there, and his inner voice says, "Ah, forget it. It will not function. Yeah, you have it 5 years, 20 years. It will not function." And we do our job. And after 20, 25 minutes, he stand up and you think, "What's going on? My knee is better. I can walk. My hip is better. My back pain is away." And then that's the biggest motivator to make the people who are very skeptical, to motivate them. Now you have the proof. Now do your exercises. And maybe 2 weeks later, you go again to a therapy. But our aim is not every week therapy, because
Right.
we say we are not able to heal the patients. Only the patient itself can heal itself. And so we are more than teachers. We press the points and then we make him feel that the pain is reduced, and we explain him the exercises. We give him a hand to help him to understand, to do the exercises right. And in the moment, he has another pain some months, some years later, and he is not sure, oh, what can I do? Then we are partner for him for one life, for the whole life, if he wants or if she wants, to help them to put the pain away. And in this very seldom cases, it's the need to make surgery, to make an operation, to put in an artificial joint. Then thanks God that it exists, because then it's like a wonder they don't need to sit in the roll chair. What is the English word? You know what I mean? Yeah? They can't walk.
Right, right.
So it's better to have an artificial joint in it. But what we do, not at first painkillers for a weekend. Yeah, it's okay. He has some event. It's okay for some days, but not as a long time solution, because so many bad side effects. We don't want it. And even surgery, my opinion, they should try at first the exercises. If they can't help themselves, then to go to a therapist, he helps. And in mostly cases, then it's done. And if it's not done, then all the other things like painkillers and surgery can happen. If we would do it like that, we would save money like crazy. Yeah, the state it would be so relaxed for the financial society situation. Yeah, we only have to turn around what we do first and what we do then, in my opinion.
But you also mentioned that, the mind plays a very important role in the whole self-healing process. So what role does the mind or the mental health play in the self-healing process?
A very big role, because chronic pain patients who are suffering years or tens of years or 30, 40, 50 years, it's not a life. They are only suffering. Every day is not a normal day like we can live in happiness and in a good energy and all. For them, it's done. Yeah. And so their mind is very, very negative. They are in a negative spiral, which is daily, monthly, yearly, worse and worse and worse. And now we come and we only need to help him a little bit so that he feels one day, oh, now my pain is gone. And what happens? And then a positive spiral is more and more developing. And this turns the mind from very negative in positive, hopeful, and also motivated to do the exercises, motivated to take some other therapies. And that changed the mind. Because with this bad mind even is muscle contraction. Yeah, stress, bad mind, fear contracts the muscle system. And what we're doing is the opposite, relaxes. Yeah, like you do it here in India with breathing exercises and the wonderful yoga things and all this. Yeah, and that we have to do so that the mind can shift from negative to positive, and then it's a good help for them to be on the right way, to stay on this way.
Well, this has been very insightful, Roland. The inputs, the research that you have actually done in your therapy, and it's fascinating that it's actually now available in India, so people can actually experience this firsthand.
So thanks a lot for the invitation for this interview.